Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio. Call me, 888-630-9625. That's 888-630-WMAL. Well, we bit the bullet and we missed one. No snow for us, any significance whatsoever, just kind of a dusting. I got up this morning wondering, slush, here we go again, and my dreams of Western New York were gladly dissipated because I grew up in that nonsense. And, this is the time of the year where we usually get snow there, not here, so thank God we live in Washington. 888-630-9625. Have a whole bunch of things I want to discuss with you today. A new product on the market, natural product, coming from one of my favorite laboratories, Thorne Research. We're going to talk a little bit about that. It's anti-inflammatory effects on arthritis, but we're going to talk a little bit more about what inflammation is and when it's necessary. We're going to talk a little bit about when lumbar disc pain, low back disc pain, is not due to the herniation of the lumbar disc. We see so many different x-rays that come in our office, MRIs and so forth, that show absolute herniation of the disc. But that's not what's causing the pain, wouldn't you like to know? So we're going to tell you a little bit about that, and we're going to talk about some natural solutions to sleeping. And if we have time, a subject I want to talk to you about, sources of toxic disturbance in your body. So we have a whole bunch of things. Plus your questions. Obviously, I'll get to those first because those are the most important things. 888-630-9625. Want to remind you that the Thermography Centers of Fairfax, ongoing sponsor of Dr. Tom Roselle Live. If you have any questions about thermographic imaging, please call Dareth Painter at 703-943-7248. Call Dareth, 703-943-7248. Thermographic imaging is one of the most important things you can add to your annual examination process. It will show up inflammatory process and cancer, ladies, in your breast tissue 5 to 8 years before it'll show up anyplace else. Wouldn't that be nice to know about so you can do something about it? What's the product that I'm talking about? If you have arthritis and joint pain and rheumatoid and all of those things, there's something that's potentially very, very effective, and it's kind of hitting all the journals. There's some original research that was just published in an alternative medicine journal, and one of the best journals, as far as I'm concerned, on clinical therapeutics in the alternative world. But having said that, this article is about, and it was a 3-month study of a substance put out by Thorne Research called Meriva. And Meriva is a patented proprietary blend of something called curcumin and phosphatidylcholine. And it's a phytosome complex that apparently will dramatically decrease joint pain and improve joint function. And the study was in 2 parts. There was one that was involving 50 people with osteoarthritis, degenerative disease of the joint spaces. There was another one that involved 100 patients. And the results are really remarkable, even from my point of view. I was very, very impressed with what they found. But what you need to know about this is curcumin, first of all, is an extract of turmeric. Or turmeric, whatever you best pronounce it. And it's a supplement. It's a food-grade supplement. There's no drug involved in this thing. And the thing is that curcumin, in our experience, is generally very poorly absorbed into the bloodstream. So that's why it doesn't work as well as all the studies say it works. But in this particular situation, got my attention because the experts have found an answer to allowing curcumin to be better absorbed, and the technology is called phytosome technology. It's very interesting in how this has come about. We're talking about nanotechnologies these days. Well, this is allowing this substance, the active ingredients, to be able to lock in and get into the receptor sites of where they belong. So, we talk about knocking down inflammation, and inflammation is bad for you, and it's not something that, we're talking about chronic inflammatory process. But inflammation is a normal response in the body, but it's also a contributor to many reactions that go on, a necessary contributor. The response happens immediately, automatically, without you even having to think about it. The primary objective of the body's normal production of inflammatory response is to break down and isolate things that are irritating to tissue and then begin to stimulate repair to tissue. The problem comes when it gets out of control and it doesn't stop. But let's talk about normal inflammatory response first and what that really means to you. It has a physiological impact on your body that is extremely important, and it can arise from any kind of injury. It can come from infection. It can come from things that you're eating that you shouldn't be putting in your body. It's a normal process that encourages your body's ability to heal. Now, here's the deal. So from a very slight bump to a dental procedure, to a stress pattern that you have, to, as we said, eating things that are not supportive, the normal inflammatory response is always there. It's always at work to keep your body healthy and to restore your health as best as possibly can. And there's a lot of things that depend on this and on your individual health. But the body's normal inflammatory response is a protective response. It's something that happens, as I said, in reaction to irritation of injury of any kind. But sometimes the response continues. And it's prolonged, and it's due to deficiencies in the body. One of the deficiencies is essential fatty acids, or your omega-3s, and other nutrients that are supportive of your B12, B6, folic acid, that are at low levels. And supplementation with fatty acids or other nutrients are often suggested. We do it in our office ongoingly. But sometimes there are other reasons, for the prolonged inflammatory response. And physical therapy, manual manipulation, acupuncture, dietary changes may all be very helpful. And we've, particularly in our work, we've found it be extremely useful and to be, and when put into a place where they're combined together particularly, it begins to turn things around, quite dramatically. But let's talk a little bit about this new Mariva, this proprietary blend. As we said, it's, curcumin is basically turmeric. It's a well-known herb. It's been around forever. It's a potent antioxidant, and it really offers you a great number of really great health benefits. Most of the benefits come from the extract, from curcumin's strong antioxidant activity, and its ability to support the body's normal inflammatory pathways. Curcumin interacts constantly with different biochemicals in the body, and it promotes the body's normal inflammatory response. And that's what you want. That's what you want to have happen. But again, we're talking about something that gets out of control and then begins to cause things to break down. And that's the subject that we need to kind of discuss here a little bit. So let's kind of take the pieces together. We know that drugs for arthritis like Celebrex and so forth are basically high-powered NSAIDs, non-steroidal anti-inflammatories. They have very depleting effects on the body, particularly on the heart and particularly on the kidneys and the liver, and they do a lot of damage. So we need to find a way to knock the inflammatory pathways down, but also to support the body in its repair process. So this one study, this one particularly with 100 different patients that had degenerative osteoarthritis, and it was confirmed by X-ray analysis and some blood work and so forth. The study showed people who were asymptomatic cardiovascular, and they didn't have hardening of the arteries, and these people were considered eligible for the study because obviously they wanted to take all the other risk factors out. Now, according to the American Rheumatism Association, these patients participated in an open, productive evaluation that was, in their opinion, complementary for the management of degenerative arthritis. And it goes on to describe what that's all about. And for our conversation here, really not that important. But what they did is they broke it down into categories of people who were able to carry on normal activity and to work and needed no special care, and unable to work and to live at home, and so forth, and very amounts of assistance were needed in daily activity, and then those who were unable to care for themselves and needed assistance. And the subjects were put on this combination of phosphatidylcholine and curcumin, and nothing else was altered. And what they found over a period of 9 months of the study was significant turnaround in the capacity of these people to function. For example, they had a control group, so it was a double-blind study. They had a control group and they had a treatment group. In the treatment group, they had a significantly decrease in use of NSAIDs and painkillers. 63.4% of the people that were in the treatment group compared to 8% in the control group. And then in the treatment group, because remember there was the side effects of all these other drugs, had gastrointestinal complications and so forth, 66.7% of these people no longer had any problems compared to 12% of the control group. And the decrease in use of drugs was 43% in the treatment group and about 7% in the control group. And then the management costs. This is the amount of money that you spend on drugs and going to the doctors and rehabilitative services and so forth, decreased a whopping 64% compared to the control group. And the edema, the swelling went down almost 70%. The decrease in hospital admissions just for consultations and tests went down 45%. And so forth. Amazing. I mean, this study was like, oh my gosh, this stuff might actually work. And it gets into how it affects things that are called, prostaglandin E2s and oxidase synthesis, and which is nitric oxide, which is increased oxidation reactions within the body. However, we're not going to get into that because that's a subject for a different type of debate. But nevertheless, this substance, this Mariva, has apparently the capacity to transport things much more rapidly, utilizing it within the tissue. And when you add that to some of the other things, particularly with acupuncture and change of diet and so forth, there's actually hope here that you might be able to turn around a chronic arthritic patient where they'll get their joint spaces back. It's amazing to me. Things that we've known for a long time, and we've tried and tested and applied differently, but this is one that really brings it out. And if you want to read the full article, I would encourage you to go to the Journal of Alternative Medicine Review. It's volume number 15, number 4, and it came out December 2010. You can go online. They should, lie to them, tell me your doctor or something, whatever, and you can get the journal. But it's very well written and very understandable from knee arthritis and so forth. Having said that, Fred, you've been holding very patiently. How can I help you? Thank you for calling, my friend.
I just wanted to know, Doctor, this is kind of off your topic, but I've been wondering all week since I heard this, if pasteurization of orange juice kills the vitamin C in it.
Yes, absolutely.
So when I buy this half-gallon of orange juice, it says it's been pasteurized, that's just saying, hey, we've killed all the nutrients.
Yeah, if you've noticed that most of these products say vitamin C added, and the reason that they do that is because they know when they heat it, and pasteurization is a heating process. Vitamin C is very unstable in heat, and unfortunately, when you pasteurize anything, when you heat it, it's called heat label, and vitamin C is destroyed by the heating process, and it depends on how long it's been cooking. It depends on how much vitamin C actually gets destroyed. So the only place that you're going to get some natural vitamin C is if you go get an orange, or you get an apple, or you get vegetables which have a lot of vitamin C in it. But the effect of processing any of these things, it has an effect on protein. Proteins get broken down to some extent. That's why when you eat a piece of meat, if you're going to get a piece of cow, you have to eat it basically close to being very rare. But anyway, we'll get into that. And unfortunately, the answer is yes. Fred, thank you for your call. I hope that helps you just a little bit.